answer and discussion. So to start off, Maj, did you want to say any other words before we start?
Sure. My name is Maj Steffen. For anyone who doesn't know me, I am, as Linda said, the Opioid Prevention Program Coordinator at the Toledo-Lucas County Health Department, and I also chair the Lucas County Opiate Coalition. And I'm really excited to listen to this panel. I think it'll be a great discussion about how COVID-19, the pandemic, has affected the current situation on the opioid epidemic, especially locally. And so welcome. I'm so glad you could make it. Thanks, Linda.
Thanks. So let me introduce our keynote speaker this afternoon, Director Alicia Nelson. Director Nelson currently serves as the Director for Recovery Ohio, a new initiative designated within the Office of the Governor to fight Ohio's public health crisis, focusing on mental health and addiction prevention, treatment, and recovery support services. Before her time in the governor's office, Nelson served as the Director for Substance Use and Policy Initiatives in the Ohio Attorney General's office. While in the Attorney General's office, Director Nelson co-chaired the Ohio Joint Study on Drug Use Prevention Education, which developed the Drug Use Prevention Education Resource Guide, which has been shared with schools and community prevention organizations statewide. She also served on the Attorney General Insurer Task Force under Attorney General DeWine to assist in the development of recommendations to help 8 of Ohio's largest healthcare insurers address the opioid epidemic. Prior to her state work, she worked for the Alcohol, Drug, and Mental Health Board of Franklin County. Director Nelson holds a bachelor's degree in strategic communication from The Ohio State University and a master's degree in business administration from The Ohio Dominican University. She cares deeply about improving the care and support for those who struggle with mental illness. We're very happy to welcome her here with us today. And Director Nelson, we will start your slides.
Thank you, and I'm honored to be here with you guys today. I'm going to stop sharing my video so I can see my slides. The challenge of working on the small screens with you, but I am definitely still here with you virtually. So thank you all for being on the line. You can go ahead and go to the next slide. As Linda mentioned, my name is Alicia Nelson, and I'm the Director of Recovery Ohio. But one of the roles that I also will talk about today is my work with the Minority Health Strike Force on equity. And we certainly see the need for that in the behavioral health space, which I'll get into later in the talk today. Next slide. The governor has been focused on helping those with mental health and addiction needs and their families since the very beginning. And he understands that this touches all communities, this touches all sectors of government, this touches business, and he really wanted to see initiatives that brought everyone together to talk about the kind of interwovenness of state government in the solution. And really what he has done is establish Recovery Ohio to work across 17 different state agencies when you think about the Department of Health, Mental Health and Addiction Services, Rehabilitation and Corrections, and many more, to make sure that we are all swimming in the same direction when it comes to our response to this public health crisis. You can go ahead and go to the next slide. I'm going to go quickly through these. And really, our goal is to focus on prevention and education, making treatment available to individuals who need it, and provide support services and recovery support services to individuals and families in need. And one of the other really critical areas that we discuss is the law enforcement aspects that I think sometimes get lost, but are critical in this work. And we are really excited to have, in the next slide, you'll see Sheriff John Tharp on the team with us to talk about how we really can look at this from a number of perspectives, not only from the perspectives of government, which I've already talked about, but also from the perspective of the individuals and families impacted by the disease of addiction, impacted by mental illness. And really, you'll see that this is a passionate group of people who, like myself, have experienced these things personally and want to see change and continued improvement in a number of areas. And that improvement, it needs to happen across a full continuum of care, and really understanding how prevention and early intervention services, crisis services, treatment, recovery supports, and then sustained recovery kind of are mixed within all the work that we do, not only at the state level or the national level, but at the local level. And I know that you'll hear from our local experts and leaders, the commissioner and Scott, who are great partners in this in your area as well, who understand the interwovenness. And if you go to the next slide, you'll see what that means for us at the state level. And to us, that means that all of these agencies really have to come together. No one thinks of us as separate entities. People think of us as the state. And it shouldn't be hard. It shouldn't be a full-time job to get and navigate through our systems and get the care that you need. And so what can we do through data innovation? What can we do through our interface, through our systems, in our hospital systems, in our prison systems, both for youth and adults, that could really help and partner with our local communities better to make our systems more seamless. And so that's really how this all ties together for us. Thinking about what we are dealing with this year, COVID, as you all know, has really changed a lot for us. And we were really well on our way with our plans for Recovery Ohio. And then, like all of you, COVID-19 came and impacted everybody pretty deeply. And what we knew is that we were all in this together, but we weren't in this together and on the same boat. I mean, some folks were coming from this from different perspectives, different resources, and those things that they experienced before that pandemic are being exacerbated in the pandemic, whether that's housing insecurity, transportation issues, job loss and job insecurity. All of those things have just been exacerbated. And so we have to understand, again, that connectedness and all of this to be able to move us all forward. And so what does that look like for the behavioral health system? When we talk about exasperation, and this I think is a perfect example of that. And you guys are a lucky group that just are coming off of the press conference. We just announced today if you haven't seen the governor's press conference today, I'll tell you a little bit about what we announced today in terms of our next steps in this effort. But I want to talk for a second before I get into that about the why the effort was increased. And so what you see in front of you is just a kind of a historical outlay of month-to-month unintentional drug overdose deaths. And as you can see, the unintentional overdose deaths are the red line here. We saw what we thought were record highs in 2017. And that year was just a devastating year. I mean, the numbers were just so hard to fathom. And all of us who have worked in the system for a long time were feeling a lot of, effort was needed to continue to push forward and impact these numbers, because this was just so hard to comprehend, and the loss and grief that we saw in the communities was just really hard to comprehend. And then 2018 happened, where we saw decreases in those numbers for the first time, I think, at that point in time in a long time. and that decrease was just at around 22%. Then we saw that decrease hadn't sustained, and you guys will get and see posted here shortly the 2019 drug overdose official stats. So I can't get quite in the numbers since they haven't been completely posted, but what you can see from this graph here is that some of those decreases did not sustain in 2019, and we saw slight increases in 2019. And then you see the 2020 data, and this is all currently available on the Ohio Department of Health's website. We do and have established a dashboard to take a look at this. And what we know is that May and June of this year have been some of the highest numbers on record, actually the highest numbers on record. May particularly was a deadly month for Ohio, as you can see in the chart there. The blue line, just for the folks who really were looking at this and wondering what that is also our ability. We also track some of the emergency department visits as well. But fentanyl was the key driver in these deaths. Again, for 2020 and 2019, we continue to see increases in the impact on African American males, or starting to see significant increases in African American females, and really need to continue to have conversations about how this crisis has evolved and how we need to address addiction and mental health services in communities of color in a holistic way. And I'll talk about that more in a moment. Looking at the next slide, what we know is that even with these overdose deaths, we know that behavioral health problems are going to be the most commonly experienced adverse health effects of a pandemic. When a traumatic event happens, such as a pandemic or a tornado, communities feel anxiety, they feel stress, and all of those things are going to be heightened at that time. And really, people are going to start to feel, and what we've seen is that all of us have started to see maybe have some sleep difficulties, and seeing increased use of negative coping strategies like the use of alcohol, the use of nicotine, and some of those other drug trends that we're seeing are definitely significant. We don't talk enough about alcohol, and that's one of the things that we'll continue to talk about. And, we know that the pandemic will have long-lasting impacts on behavioral health. And so what we know is that we have to really start to have conversations about how do we impact the numbers that I just showed you now, and then how do we impact the long-term and promote long-term health and wellness as it relates to our mental health, and getting us to a point where we have that resilience and can get to this all together. And so I just want to point out that we're thinking of all of those things as it relates to behavioral health, although we have a strength and focus announced today on overdose deaths and strength and focus on suicide. We're also thinking about the just general overall health and wellness of Ohioans. So if we can go to the next slide, I want to talk quickly. You'll notice some familiar faces here. I know I'm running a little over on time, so I'm going to go quickly through some of these things. But again, going back to that focus on the minority communities, I had the pleasure of coming up and talking with a number of Lucas County residents to discuss what we can do in the behavioral health space to impact communities of color. As you can tell, this was before the COVID-19 pandemic. We're not wearing masks, and we're pretty close in this picture. But the conversations were ones that really hold true now. And you can go ahead and go to the next slide. what we know, and this slide is a lot, but I'll just quickly go through it, is that, there's a lot of conversations about trust, trusting relationships. There were conversations about respect. There were conversations about thinking about faith and extended family and food and all of these things that make communities of color thrive. What was interesting is those are some of the same things that we heard in the Appalachian communities. Those are the same things that we heard in a variety of communities of color and in the Somali and Bhutanese, Nepali communities here in Franklin County. And so what we want to do is continue to share what is working as we try to be resilient and thoughtful about how we're all in this together, but maybe come from a different, are in a different boat, but have that different perspective, and how we can treat and work together to support one another in these difficult times. You can go ahead and skip through the next couple slides. I think, and I'll just keep going. I realize I came heavy on the slides today, but I think that was the gist of it. And if you can go down one more slide, I think, what we know is it is our job to serve all people in Ohio and bring people together and seek out opinions and ideas. And this is the governor's quote in our most recent plan of action to advance equity that we released as a part of the Minority Health Strike Force. But really, this is true for the behavioral health community. It's true for everything that we do, is that we have to understand where people come from to serve them better. And what I hope you heard me say in this presentation is that we are dealing with a surge. We are seeing that both in our overdose and suicide rates. The surge is something that we all are going to feel because of the anxiety and stress of a pandemic, and that it is different for each individual. And even though we're all in this together, we have to tailor our strategies to meet the needs of all people where they are in their struggle, and make sure that we are listening to those needs and not assuming what those needs are, and really be continue to be adaptable. And I know that that's true in Lucas County from the programs and services that I saw and the conversations that we had at that Minority Health Working Group, of just thinking about how we all approach things differently, we look at things differently. And that's going to be the true difference maker, on top of social distancing and wearing a mask and staying 6 feet apart, which is the COVID message. The second step is understanding that people need help, and we all need to kind of understand where people come from. With that, I do want to share a couple resources that are available for you that kind of goes into this in a lot more depth than 10 minutes can offer. We have a number of strike force reports that talk about racism as a public health crisis, that hit on what we need to do for minority communities in COVID-19. We've done a lot of those. You can check out the website. And then finally talk about what the state of Ohio is committed to do as a response to addressing equity in our state. If you can go to the next slide, I also want to just make sure that we walk away with this COVID care line, which will make sure you get out. If you or anyone you know needs some support in these times, this number is available 24 hours a day, 7 days a week. And finally, I'll just close with, I know that we're all kind of trying to take care of others, and my message was, understand to take care of others and think about others, but I also want to take care of you. I'm skipping down a couple slides, sorry, Kristen. But self-care has to be a priority. Take time to turn the TV off, take breaks from media, especially this week. This has been a media heavy week, I know. Take care of your body, take time to unwind, find reasons to be grateful, and then, because we need you to be your strongest and best self as it relates to the pandemic response, and that's really an important piece too. So with that, I think the last slide there is just some of the other resources. I know I talked about those 3 reports. There's also a Recovery Ohio report and coming soon, annual review. So you can see kind of where we've been in terms of our progress on the Recovery Ohio report and those 75 recommendations that was put together by the council. So with that, I'll stop talking, and I'm sorry I went over a little bit, but glad to be here.
No problem at all. Thank you, Director Nelson. That was a great overview, and we'll look forward to having an opportunity to talk with you a little bit later in the presentation and ask questions. I understand that some of you had some connectivity issues. I really apologize for that. We aren't sure what really happened, but I assure you that we are recording this session, and we'll make sure that everybody gets a copy of the link so that you won't miss any of Director Nelson's presentation. Some important information there. So I'm glad everybody has joined us now. I want to introduce next one of our panelists, Dr. Eric Skodinski, who's been working in public health for over 28 years. His career started in the Cuyahoga County, Ohio Health Board of Health, working as a sanitarian. In 2001, he obtained his MPH from the Northwest Consortium of Public Health, and in that same year took a position as an environmental health supervisor at the Toledo Lucas County Health Department, and that's where it all began. He then went to be supervisor of the Western Lucas County Clinic for the Toledo Lucas County Health Department, then Northwest Ohio Regional Public Health Coordinator and Director of Environmental Health. Since 2016 in June, he's been the Health Commissioner for the Toledo Lucas County Health Department. In the spring of 2020, he obtained a doctorate in public health and leadership from the University of Illinois at Chicago. And he's co-authored 3 editions of a book, Essentials of Public Health Management, which is currently being used in a number of academic and business settings. So Commissioner Skodinski, you're going to give us some perspective on the local situation here in Lucas County.
Dr. Bukowski, thank you very much. And it's an honor to be on the panel today. And I do appreciate the ability to talk about us locally, what we've been able to do in the time of pandemic as I cough. The idea of public health is really foreign to many people. So let me just start off by talking a little bit about that. We are not looking so much at the individual issues within inside of a community. What we're looking at is the entire community. Yes, it does start with the individual. It can focus on the individual, but to get to the bigger picture of health within inside of a community, that's really what drives us. Unlike a doctor or at a hospital where they're looking at the individual and the clinicianal aspects of that. So again, I just want to make sure we understood that definition before I moved on for some who may not understand public health. And I've been in a number of years, and sometimes, that definition gets skewed as well too. So again, it's important as we start to talk about what we're looking at with COVID and the pandemic to understand that we're looking at the entire community. I wanted to start a little bit about what happened during the pandemic for public health, which does connect to the issue that we're talking about today. Not just mental health and the addiction, but the overall stress level within inside of our community. Unfortunately, my department got hit early on with COVID. We actually had a number of cases of staff, and it actually decimated my staff for several weeks. So you could imagine us having to respond to not only the pandemic issues, but attempt to run programs and to keep programs afloat and to be able to make sure that, again, we are protecting the public health during that time. And one of those programs that we really were focused in on to make sure how do we sustain the program and make sure that we're providing the necessary resources to the community is looking at our opiates, our opiate issues within inside the community, specifically looking at our needle exchange program that we have, as well as then the naloxone distribution and there's so many partners that we work with. At that point in time, we were inundated with so many requests for different things, but there is a segment of our staff that really did focus in on what do we need to do at that point in time for our community, for this segment of the population that truly does need these services and these resources. Staff stepped up to the plate. We had individuals who were in both those programs, if you would, the needle exchange as well as our naloxone distribution, and said, what do we do? And there was very much an intent to look at how do we service the population in a different manner to make sure that, again, the issues of the pandemic and COVID and possible infection exposures were handled appropriately. And we did just that. We were able then to do drive-up services for naloxone. We actually looked at some other things. And let me take a breath here and talk about the pandemic. It's done terrible things to every community across the state and really in the country as well as the world. It's affected so many different individuals in so many different ways. The stress level is immense. Whether you're reacting to the pandemic or you have to actually work in the pandemic, there is a lot of stress. But it also gives us a time to focus, to reflect. What works, what doesn't, what new things can we bring in? How do we actually address issues within inside of our own community? Because you are going to have to think of things differently, and it's coming at you fast. Some things that came out of looking and reflecting about the pandemic, we developed street teams, and these street teams actually would go out, and they have now for months, go out to hot areas, hot zones, where we're seeing, overdoses or issues with, opiates. And what we're able to do then is go to the problem. We looked at too, if you would, online ordering of naloxone, to be able then to, again, get that out to the community as it's needed. Where the ability for us to do things differently, to service the community, to make sure that we're giving those resources was so important to us. But again, bad things happen with the pandemic, but good things also happen relative to how we can help the community. And again, we continue to think of new ways to actually be devised to again have people access our resources. But then again, how do we in the future, because it's going, we're going to have to deal with the COVID problem for many months to come. How else can we better these programs? What other programs can we bring in? What else do we need to do? What's working? What's not working? So again, it's really important to understand that reflection was very critical to improving our ability during the pandemic to, again, be able to do what we need to do, and that's protect individuals that are vulnerable at this point in time. I would love to say that everything is really working out well for us during the pandemic. We have some little blurps, if you would, some hiccups with delivery of services. But again, we all know that that's not the case. Again, we are having issues with some services being delivered. So at least we did, not so much now. But again, taking stock in those and adjusting on the fly to make sure that those are done is important. And adjusting on the fly, I want to give some numbers here. And stats are always hard, I think, for people to really take in. But I think these are going to be very telling. So what happened last year before the pandemic to this year? Trending analysis, looking at the forecasting ability, the historical perspective to get to us to next year. I don't know if we really thought that these numbers were actually going to happen. I'm just going to give you a couple months here. So if we look at June of last year with our overdoses, we had 125. If we take a look at June of this year, again, pandemic season, 262. Yeah, if we take a look at the fatalities, we had 16, and even more unfortunate, we had 22 in June of this year. If we look at July, because we're moving down this pathway. If you remember June wasn't too bad for us here locally with cases. It was July that we started having some issues. So again, 154 last year, 221 this year. Again, substantial rise in overdoses. Again, this isn't good, but I guess it's as good as it could be. The fatalities we had last year were 11. This year in 2020, it was 11. So that, unfortunately, that stayed stagnant. And we understand that, again, the issue of overdose in our community has been a true concern, and it's been significant, but it's even been more significant during the pandemic as I think this drives it home. In August of last year, 160. August this year, 242. 7 fatalities last year, 19 this year in August. Unfortunately, this last point I think is going to drive it even further home. September of 19, 180 overdoses. This year, 244. Fatalities 8. This year, 22. Disheartening, just terrible in so many levels. But I do believe that this is the reflection of the stress that's in the community, the inability to really come out of this pandemic issue to any substantial, even when it was low in June, any substantial ability to de-stress and to take stock in life. And I think those numbers are indicative of that. And we're going to continue to have stress on us for months to come. So this problem is not going away. It is something that we have to address as the pandemic stress load and the so many other resources that really aren't available right now that were prior to pandemic. We have to figure out how to make sure that those resources are getting to those individuals that need it so much. I want to touch just on a couple things, which again I think drive the idea home about the pandemic and how it's affecting our community, affecting our resources. We also have the Needle Exchange Program, which is a fabulous program. It helps us in so many different areas. Of course, the infectious disease aspect, but in so many other areas to make sure that again we can have outreach to individuals. We can talk to individuals. They may not want to talk to us, but at least there's that contact there. And so that program is really important. But the program, I think, is indicative of some of these numbers. So last year, we gave out through the entire year about 116,000 needles. So again, that's great. That's a heck of a resource to be able to give out. I only have numbers up in September. So October, November, and December, we still have to go through. As of September, we were 118,000 of those exchanges. We handed out those needles. So again, we have several more months, and I'm sure that these numbers are going to bloom past that. Fentanyl test strips, again, something else that I think that is really important for the segment of the community. Last year, through the entire 12 months, we were able to give out 2,084, right? So again, an important resource for the community. Only until September, 1,934. So we're going to eclipse that again, I'm sure of it. I think what I'm trying to do is drive the point home that the pandemic has caused us concerns inside of our community. It's had us do our programs differently. We've seen a significant increase in overdoses and fatalities. And again, we're going to have to study it a little bit more, but I think just anecdotally and on the surface, we definitely see the impact of the pandemic in this community relative to the addiction issues, relative to the overdoses and deaths. That again, I truly believe that we need to make sure that we, and I hate to say this, but we double down on our efforts to make sure that over the next 6 months, as we go through the pandemic, that we look at ways to curb these even more than we already have. What do I see in the community from a mental health perspective? Public health, for the most part, doesn't think about mental health until it really has to. I think our department does that a little bit better. It may not be the first thing on our minds when we do our programs, but it definitely is not the last or towards the last, like some health departments. Again, just the way that we're built. So we're lucky that we do have the thought about public health and the issues that we have to encounter in the field when we do our jobs, when we run our programs. And so we're lucky to have that ability inside of our department. Maj is on this Zoom, on this call right now, and she is an intricate part of what we do and how we do it. And that's the important thing. It's the staff that we have that are forward thinkers like Maj and the other staff that we have that give us the ability to, again, look at the issues like we're seeing right now with pandemic and pivot quickly and do things that we need to do to make sure that the problem that we have doesn't even get worse. So with inside of Lucas County, we definitely are seeing the stress level. We're seeing the lack of ability to access needed things like transportation, which then causes stress with inside an individual and inside a family. We're looking at the issues of, again, unemployment, not being able to, again, pay for rent. I mean, all these things that public health is really concerned with as a socially determined health, because it affects the physical health, also affects the mental health, which also then bridges into the addiction issues. And again, personal experiences too. I know Director Nelson prior to me getting on talked about use of alcohol. I know friends that are utilizing alcohol much more than they ever have. So I see it personally. I see it in the community. And again, it really truly is up to us where we sit to make a difference. And I know that public health is trying to do that. Lucas County is a fabulous community. They respond well to our asks and our needs, and they always have. And an individual that you have on right now, Scott Silac, just one amazing individual. His ability to, again, understand the mental health issues with inside the community, how to react to them, and the partnerships he now has with us, with so many other agencies and entities. This is why I think that we are well positioned and not really truly behind the curve like many other counties and states is because of leadership of Scott. So I wanted to end on that, Doctor, and I will be here for questions.
Thank you, Commissioner. That's really a sobering discussion of what we're really dealing with on the local level, but very helpful to get a lot more detail in that regard. I'd like to introduce next Kathy Bukowski. Kathy is, in her day job, the executive assistant for the Dean of the Libraries at the University of Toledo. However, she also has a very long service in terms of participating with community-based family support groups, providing supports to many individuals affected by opioid use disorder and their families. She currently serves on the board of directors of Not in Vain, which is a support organization for mothers who've lost children due to opioids. Thank you for joining us this afternoon, Kathy, to talk about some of the challenges that individuals and families have been facing along with this edition of the pandemic. So, Kathy?
Thank you for inviting me to participate. I lost my son at age 24, and he passed away before the COVID epidemic started. But I can speak to, I was part of a support group for individuals who are struggling with addiction and also loved ones who have been affected by addiction. And once the pandemic started, one of the first things we all noticed was the inability to have support groups or meetings that people normally attended that are going through these struggles. And some of the people that are struggling with their sobriety or in their addiction, a lot of them use these support groups almost on a daily basis to help keep them on track, to have peers to talk to. And I know it was really difficult for the people that are in recovery that I was working with. That's one of the first things they talked about. Their support group had been taken away, even though, it was for necessary reasons. And the group that I was with, we tried to go to online meetings, like maybe once a week, and people did join in on those, but there were also a lot of people that are struggling in their recovery that didn't have access to the internet, access to a computer. So that also became a barrier for them to try to continue to work on their sobriety. Some of the people that I know that were sober ended up relapsing. I don't know anyone personally that passed away due to that during the epidemic, but the mental health issues really definitely were affected by this. They didn't have the people to talk to anymore. And some of the people that reached out to try to get into recovery centers or treatment centers, when they realized that they were really struggling and, did not want to relapse, especially at the beginning of the epidemic when things had to close down to try to reduce the spread in our community and stuff, the recovery beds were not always available like they used to be either. So it was kind of like a perfect storm for a lot of people, all of these things coming at them, and they didn't have their normal resources available. I think some of the clinics that offered medications or prescriptions that helped people in recovery with their withdrawal symptoms, or that helped keep their desire for substances under control. Some of those clinics had shut down. And I know that now there are more resources available. Thankfully, we've been able to get some of those reestablished. They don't look like what they used to because of the precautions that we still all have to follow. And I know that the addiction rate had been up, but I really didn't realize it had gone up as steeply until I saw the Director Nelson's chart. That really caught me off guard. But I think the sense of isolation for a lot of people really set in. And along with that isolation, their anxiety levels increased greatly. And for people that struggle with addiction, unfortunately, the substances are what they use to help them with their anxiety and their helplessness, and which ended up being an increase in the overdose rates and people that were relapsing, which is really sad. The support group meetings that I was going to ended up ending totally. And like I said, I am involved with a group now that is for mothers who have lost children to addiction. My son was one of the 8 fatalities that they mentioned that happened in September of 2019. And this support group that is with our membership has grown greatly also. Since the epidemic has started in March, we are an online Facebook support group, so we have been able to continue, and people post things when they're struggling. The amount of moms that are struggling has really increased. And thankfully, because we are a social media group, we can continue to help each other. I'm really not sure my son struggled a lot with anxiety and depression, a big part of what led to his drug abuse and eventually his death. And I thought about him, not really sure how he would have handled if he lived during the time of COVID. I just don't know if he could have taken the isolation and the loss of resources. And I know that we're lucky in Lucas County. They have tried to really do everything they can to still provide services for everybody. But the reality is with the virus going on, and it was brand new, everyone was trying to figure out how to handle it. The first thing that they tried to do is limit the spread of it and try to keep people away from each other as much as possible. But I'm not sure that he would have been able to handle the isolation and the loss of like peer support systems that they had. So I'm kind of thankful that he didn't have to go through that. And I just, if he was here right now, I just can't imagine. I know what my struggle was like when he was going through his addiction. And I can easily put myself in the place of family members that have a loved one that are going through it now, along with the COVID epidemic. And I really feel for them. And I, unfortunately, according to the church, there are just so many more loved ones out there that are going through this with their family members. And that's about all I can think of. If there's anything I can help with or have any questions.
Kathy, this is Maj. I just wanted to ask a question because it sounds like virtually connecting is a really great way for people who might need some support, especially people who have a loved one who has opioid use disorder. Can you speak more about the support group that you're talking about and referring to, and maybe tell people who are listening in how they can access that and join it?
The group that I am part of the board of directors on is called Not in Vain, and the membership for that group is open to, it's strictly for moms who have lost their children to addiction. So it is a Facebook group. If you go out and search for that, it's hashtag Not in Vain. You should be able to find it on there. Or if anyone wants to reach out to me, I can try to send them a link to it. But, you know, it's a great resource for us to talk about it. And we're all feeling the same things. And the isolation for us moms who have lost our children too, even though their struggles are over, at the time their struggles end, ours intensify. We struggle a lot during their addiction, but once we've lost them and have to face life without them, the struggle takes on a whole different picture and becomes a lot more intense. So there's been a really good support system through that Facebook page for moms that have experienced the same thing.
Wow, thank you so much for sharing that with us.
Thank you.
Kathy, thank you so much for sharing. Could you also just mention the name of the book that
Oh, yes.
is a great resource? And
Yes, one of the moms in our group, has been a writer before, and she had an idea. She lost her daughter to addiction, and she decided that she wanted to put together a book that would contain stories written by moms who have lost their children. And, even with all of the experiences that we've had as moms going through our child's addiction, when you ask us about our children, we always tell you how beautiful they are and how amazing they were. We don't normally talk about the dark part and the experiences that we went through during their addiction. So her name is Bobby Ziemer, and she wanted to put, her vision of putting this book together was she have moms write stories about their life with their child during the years of addiction, and raw stories, and not sugar-coated, and so that people would get an understanding of what it's like, to watch your child go through this and eventually lose them. So the book was released last week on Amazon, and it's available in paperback and as an ebook that you can load on a tablet or device. And the name of it is Not in Vain. Mothers share their journey through their child's life and loss to the drug epidemic, and there are over 60 real life stories. And I did write my son's story and his story. His name is Dominic, and he's in this book also. Which, you know, one of the things that you go through when you lose a loved one to addiction, especially at a young age, my fear is that you always worry that people are going to forget that your child existed because you lost them at such a young age. And I've heard from some of the other moms who wrote their stories about their children that are in the book, that it makes it feel like they're still here in a way, and like they're not going to go away because I wrote his story, he's in the book, his photos are in there, and you know, anyone in the world can go on and buy the book. So it's kind of like they're living on a little bit. But the author's vision of it was that maybe it could be used as a tool for recovery centers or as a resource for counselors. If you're working with someone that is in therapy or treatment for substance abuse, that, you know, if they spent some time and read these stories, you would give them a different view of what addiction is like and how it actually affects the people that love them the most. So far the sales have been doing really well. I'm thankful. And then the money goes back to the Not in Vain nonprofit organization. And right now we have a project going on. We accepted applications till November 1st and are buying Christmas gifts for children whose parents were lost to addiction, and a lot of them, the grandparents, end up raising the children. So the grandparents are sending wish lists, and we are sending Christmas gifts to them. And but now that we're a nonprofit, we have other things we want to do. Set up some type of benevolence fund that may offer like a set amount of money to help with funeral expenses, or, you know, some moms don't have enough money to purchase an urn if the child was cremated and stuff. So we want to be able to provide assistance and help them to ease the burden of it a little bit also. So some really exciting projects, and it's only been a nonprofit for just a short time, but we have a lot of amazing people with great ideas, and so I think that we're going to be doing some really wonderful things.
Thank you, Kathy. We really appreciate all the work you're doing, even in your toughest times. I know you're still there really helping other people and other families get through this. So thanks for all your work, and thanks for sharing with us today.
Thank you.
I want to just invite any of you as I introduce our last panelists, and then we will have an opportunity for more Q&A, to begin putting any questions or comments that you'd like to in the chat. And we'll then have your questions available as we move into that section of our program. So next, I'd like to introduce Scott Silac. Scott, for the last 10 years, has been the Executive Director of the Mental Health and Recovery Services Board of Lucas County. The board is the statutory opioid hub for Lucas County and oversees a comprehensive behavioral health system for over 30,000 Lucas County residents. Mr. Silac has a master's in public administration and is a licensed independent chemical dependency counselor. Prior to joining the board of Lucas County, he started and operated Treatment Accountability for Safer Communities of Northwest Ohio, Incorporated, for 18 years. So Scott, I'm really excited to have you with us today, and we're gonna now ask you to talk about some of the systemic impact and some of your work in this area.
Certainly, thank you, Linda. And first of all, let me say what amazing strength Kathy has to serve her community in the midst of her grief is just amazing, and it makes me a little emotional. So it also makes me difficult in talking about why we do what we do. This is exactly why we do it. The staff we have here, the staff we have in our network of providers, they are doing the work they do because of Kathy and her family. It seems arbitrary to talk about statistics and, we've responded after a talk like that, but we really have to get to the nitty-gritty of what our agencies are going through in an epidemic overlaid upon a pandemic. If we reverse back to March, early March, March 17th, the community is shut down. Our organizations were impacted by the pandemic as just like every organization in our community, and the individuals that worked in our organizations were impacted by the pandemic, along with the anxiety of having to and wanting and desiring to continue to serve the populations that walk through their door every day. Unfortunately, in many cases, that simply was not an option until they were able to redesign themselves. And up until March, our organizations were mostly ill-prepared to do telemedicine, telehealth related activities. They were, their main efforts up until that time were people walking through their door and providing counseling and therapy and detox services on a billable, face-to-face service. So since that time, we've been able to look at some numbers. And, if we start to think about March through October of 19 compared to where we are March through October of 20, we've seen a reduction in the number of people that were able to access and walk through the doors of treatment services by nearly 20%. 20% fewer people from March of 20 to October of 20 than a year before. However, we also seen a reduction of revenue for that same time period of 50%. Now there's some billings that'll occur, that will bring that number up a little bit, but that is substantial because these are nonprofit organizations. Staff members, are committed to the work that they do, but they also have to eat. And so the loss of revenue in the pandemic and in the middle of the epidemic, I think that we can realistically say that impacts the ability to keep your doors open, impacts your ability to hire more staff to meet a demand, and ultimately folks aren't able to get through the door and continue in their cycle of addiction or are unstable on their mental health. We recognize that cash flow was going to be an issue for our organizations. So it wasn't very long before the Mental Health Recovery Services Board trustees indicated that we need to push funds, cash, into the organizations that allowed them to make some of the changes that they needed to get their doors back open or keep their doors open or transition to the new service model. So the board actually spent almost $2 million in a very short period of time to just handed it out to the organizations and said, you need to address the COVID pandemic. Some people, some organizations bought telehealth equipment. Others were able to supplement staff pay. Others were able to go out and buy PPE. and changed their business flow product so that people could come in the door. Nonetheless, we still saw closing of detox facilities, as Kathy indicated. But then when that occurred, we were able to purchase detox services from other facilities so that we could keep some client flow going. We saw residential units have to reduce their capacities due to personal spacing. Recovery housing had to do the same. We saw that employees got COVID just like the general population. So we saw a reduction in the ability to even get in front of a counselor because they were, there may have been a COVID positive, but then there was also other staff who came in contact who now are on the quarantine or the isolation list. So there was this whole dynamic of events that led to a reduction in capacity. Now, very few organizations actually shut down for a significant period of time. The organizations rapidly learned how to refigure their business and open their doors, but there were still some lagging options that didn't bounce back quite as fast, the detox being one of them. I think it's also important to note that there were some things beyond treatment, like the support groups that Kathy mentioned that just basically had to shut down because the organization that they were being hosted in was no longer open. A lot of the groups, a lot of the agencies then turned to virtual and technology to try and support folks as best they can. Most are open now, are doing a hybrid of telehealth and face-to-face. They certainly, as Kathy indicated, don't look anything like they did pre-March. There is rapid testing that is occurring now in the lobbies of most organizations. They're limiting the number of people that are coming into the front door and moving them rapidly out of the lobby and into their counseling sessions. Group sizes are limited. We had some, additional costs related to, and continue to have related to PPE, and of course, billing processes needed to catch up because the state rapidly put in a telehealth benefit package, but the organizations didn't know how to actually bill yet. So there was a revenue cycle that was lagging. And then, of course, the CARES Act came in. All of our organizations applied for the payroll protection plan programming and helped stabilize their activities. That allowed them to return to focusing on the work at hand as best they are able. Some of the nuances that they are seeing, like Eric Skodinski reference, they are seeing a bit of an uptick in alcohol, individuals with alcohol dependence coming through their door. They are also starting to see some methamphetamine increased use, although not as bad as where many of the other communities are. And I think that's historically correct in Lucas County, even in the early 90s methamphetamine use. Lucas County didn't seem to get hit as hard with that substance as other communities had. They still struggle with workforce. Staff are still getting sick. Rarely a day goes by where I don't hear of at least one staff member at one of our community agencies that been exposed or actually tested positive. I just want to make a mention about a couple other things as well. When you think about frontline healthcare workers, most people don't go to behavioral health agencies, and rightly so. Most people, direct their admiration towards nurses and doctors and hospitals and all of that. And it's not like they don't admire the individuals that are working in our community behavioral health centers. It's just they don't connect that to first responders and healthcare workers. And they very much are. And they very much are first responders to the opioid epidemic and to the COVID pandemic. They are deserving of our admiration. And I certainly want to give a shout out to the number of people that are in this forum today that are working on the front lines. Thank you for everything you do. There was recently, actually today, the Center for Community Solutions put out a survey around behavioral health agencies and the impact of COVID-19 on their service delivery. And while this is a statewide survey, I can tell you that all of our organizations experience very similar things. 72% indicated that they had to adjust their service models to Zoom and Skype. They're delivering services by phone. They had to close their buildings. 40% of those folks had to close buildings at one point. They delivered services outside when they were able. There were folks that were actually getting services in tents during the middle of the summer. Limited spacing, limited service models, and then client needs. Eric talked about population health, and our clients are experiencing that through the pandemic as well. Housing insecurity, food insecurity, lack of internet access in many cases, lack of childcare, and of course, we can't do one of these presentations without talking about a lack of transportation in general that permeates our community and particularly hits this population fairly hard. So, the board has worked tirelessly to ensure that there is a recognizable system of care. And we do that through our community partner agencies. We have been lucky enough to receive some funding from the state opiate response grant. We've heard Director Nelson talk about the impact of the pandemic and the opioid epidemic on populations of color. In Lucas County specifically, since 2007, deaths have, whites are 3 times more likely to die from an opioid overdose, while Black and brown populations are 4 times more likely. That's significant. That is one of the reasons we went after a minority treatment grant, and we're lucky enough to receive $1 million from Ohio MOS, Ohio Mental Health and Addiction Services, for the state opioid response. That community, that organization that runs that, New Concepts, is partnering with many of our organizations, to include the local health department, to provide some work. And beyond treatment, we fund a whole network of prevention providers that weren't able to access schools anymore because schools shut down. And so they had to relearn the way they do their business. And many of them turned to social media and are doing quite well in engaging folks now, but it is still something they have to learn how to do. Finally, I'd just like to mention that the recognition of the anxiety of losing some support services or dealing with the pandemic or even the social unrest that is plaguing many of our communities. The board worked to develop an emotional support line. And I know there's a lot of different lines out there, and we really don't care which line you use as long as you do use one when you need it. But our number is 419-442-0580. And that is staffed by peers with lived experiences. So it's usually open 7 days a week. I think it has hours that are about 12 hours a day. If you go to our website at Mental Health Recovery Services Board, you can find out their hours there. But you know, the agencies are working hard. The community expects our organization to maintain a network of service providers, even in the pandemic. And I can tell you that myself, our community partners, my staff are committed to doing that. So I appreciate the time that I was given, and I will defer back to Linda for any questions. Thank you.
I actually have some questions for you. So one of the people in the chat, Dr. Lindstrom, actually mentioned on the topic of revenue or contributions to nonprofits that the 2020 CARES Act allows donors to take 100% personal tax deduction for the direct donations to nonprofits, which expires 12/31 of this year, which might be useful for nonprofits to share with their key donors. So I just wanted to read that comment aloud. But I actually had a question on here that I think you might be able to answer really well. Someone mentioned that they were currently thinking of the community as youth under the age of 18. So do you have any thoughts on how the pandemic has affected resources or programs for that age group for prevention efforts to this problem?
Yes, thank you for that question. And thank you for the CARES Act information as well. Many of our agencies are experiencing a reduction in fundraising, private fundraising, because they can't hold their events the way they normally do. They've moved to virtual events, but you know, that just doesn't generate the revenue that live events do. So in relation to prevention and children, first of all, let me just channel my manager of prevention and mental health promotions, the manager's language. We believe that prevention and mental health promotion should be across the lifespan. In regards to, so we have programs that target that age groups across the lifespan, because prevention and mental health promotion is different depending upon where you are in your stages of life, right? Our prevention programming never stopped. It just had to change. We were no longer able to engage in school. You know, to do face-to-face programs in school. So we challenged all of our prevention providers to use their contacts and use their networks to redevelop their prevention messages and do what they could do. Think about that. I'm government. And we said, don't worry about what we contracted you to do. Do what you can do. Because we still knew that those prevention messages needed to get out into the community. And it was a learning experience for everyone. Now, there are a few groups that are starting to do a little face-to-face activities outside of schools, you know, but those are limited. And honestly, we'll continue to contribute to our prevention programming and hope that the upcoming SOAR funding that we're able to request, we'll have a strong emphasis on expanding our prevention and mental health promotion activities even beyond what we're currently doing.
Thank you, Scott. Oh,
Go on, Linda. Sorry.
okay. I was just going to thank you, Scott, for really giving us some great perspective on what's happening here in our communities. And I wanted to maybe invite Director Nelson to comment now that you've kind of heard more about what's happening in our local area. You have some thoughts either on, you know, programs or funding we should be really aware of, or some real insights on sort of where might we go from here, you know, given all of the state of where we are. Do you have some, you know, encouraging, you know, or would encourage us to do, you know, certain things or to really focus on certain areas in line with the state's overall strategic vision?
Well, thank you for the opportunity. And really, I'm just so impressed by the commissioner, by Scott, by Kathy's efforts, and what we see in Lucas County. You guys have been blazing trails, not only from your perspective, but the sheriff's office is blazing trails with the DART team, and we just need to keep doing more. And really keep advocating in this time. And I'm an advocate, will always be an advocate. I can't remove that part of myself, even though I'm in the governor's office, for the importance of continuing to, you know, keep mental health on the list. As Commissioner said, keep addiction on the list. And it's in everything that we do. It's in our families, it's in our communities. And the more that we can decrease stigma and have real conversations about what we're feeling, the better we'll feel. And I think that, you know, in terms of funding, to Scott's point, the $96 million we just got from the state opiate response, for the state opiate response from the federal government, going to be another key in our next steps for that. Of course, well, one of the things that I'm really excited about in that is the opportunity this time to look beyond opiates, to look at integrated services, look at dual diagnosis. We didn't have that opportunity, but I think that we've all advocated hard to our federal partners about how all these things are connected. And so to continue to, you know, thread those things together is going to be important. And again, understand that everyone comes from a different lens and may need different support. And you know, one thing may work for some, and another thing may work for others. And I know telehealth has been an important piece, but it's not working for everyone. You know, I think about our kids and our networks who, you know, may not be able to use telehealth in the way that adults have. And so all these things are kind of converging together. I think I'm really excited about the conversations and where things are going. And you know, I'm hopeful for a better future for Ohio. I'm hopeful for continued conversations about these issues. Never has the behavioral health system, you know, really been at the forefront as they need to be. That's my personal opinion. As a person who struggles with a mental illness, you know, I get how I can't separate it from who I am, and I think that you know, I'm hopeful for the conversations that keep bringing that to light.
Thank you very much. Those are some very great observations. I think Maj wanted to comment.
Yeah, I know we're getting close to the end of this webinar, and I just wanted to really thank everyone, all the panelists for, you know, sharing each sector of their view of the opioid epidemic, because I think that one thing I've noticed from my role and my position as chair of the coalition, for the Opiate Coalition, is that this is a community that really cares. And we're in this time where a lot of negative things have impacted us because of the pandemic, but a lot of positive things have happened too. And we're really collaborating between agencies that need to communicate. And we're finding those gaps and attempting to bridge them. And so I'm really excited as we move forward and more funding does become available to look at what each of us are doing and where we can bridge that and keep these conversations going, keep talking about all the different aspects to care. And while we're still in this pandemic, because we still very much are, I think that if you're watching this from either a member of the community or a representation of any agencies that have a part in the opioid epidemic, the best thing that you can do is get connected and get all the education for as many resources as you possibly can for the people that you serve, whether it's harm reduction or whether it's making sure that you have a road to access treatment. It's just really important that we're all sharing information that's going to benefit the people that we serve and meet them where they really are at right now in the middle of this pandemic, because things are really weird and they need our support more than ever. So thank you so much to all of the panelists. And I'm just so happy to see these conversations happening in this live setting. It's really exciting. So I can't wait till the next one. Thank you so much for having me as a moderator too, Dr. Bukowski.
Thanks, Maj. I wonder, Scott or Eric or Kathy, do you have any last comments that you'd like to add before we wrap up today?
Not really. Like Maj was saying, I'm excited about all of the different things that people are talking about. Some things I hadn't thought of before, but we've all been thrown something that's so out of the ordinary. There isn't really a way to plan for this epidemic that happened in that, but everybody just kind of pulled from within themselves and it pulled together as a community to try to figure out how we can best serve each other with all of the challenges that we're facing.
Linda, I think my closing remarks would be just echoing what Maj just said. You know, we need to continue to communicate, to dialogue, to look at new ways of doing things. You know, we are in a point in time with COVID that, you know, I think we all kind of reflect differently now. We see things through a different lens than we did 6 months ago or 7 months ago. For many of us, I think that changes our thought patterns and how we can, you know, actually adjust to issues or approach new concepts. So again, that would be my thing, is just to make sure that we continue communication and look at ways to do things better.
Thank you. And your little doggy got a few words in there too, so we appreciate his comments. Thank you very much. Scott, did you have any last thoughts you wanted to share?
Yeah, I certainly.
Lost you, Scott. Oh, there you are.
Thanks. Sorry about that. I certainly appreciate the support of Eric and his staff and Kathy and her journey. And but I got to tell you also, having Director Nelson in the governor's office at this time, at this place, is just invaluable to the recovery community and the organizations that really rely on, you know, that support coming directly from the top in Ohio. So thank you very much, Director Nelson. And also, you know, of course, Linda, appreciate all the work that UT's going, and they're a valuable partner in our community. And it's just, you know, wonderful that we can have these conversations, and we just need to continue to do more and do it better and do it quick.
Thank you. Well, was there someone? It's hard to do, you know, in this little virtual thing. You can't see the person raising their hand. So I just want to thank everyone again for participating. We had an amazing group of panelists here today, and they're doing great things, and we're so lucky to have them in our state and our communities. I do want to appreciate the Opiate Coalition and Maj. We're very happy to have this relationship, partnering with them via our University of Toledo and community partners, Opioid Task Force. You know, definitely the old takes a village, you know, phrase is very important to all of these health issues that we're talking about here. So again, just thank you, and thank you for all the people who are listening to us today. We know that many of you are out there on the front lines or some lines, and you're all either dealing with it yourself or dealing with it through your provider status or your work status in some way. So thank you for all that you're doing too, and thank you for joining us today. We will make sure that a video recording of this event will be shared with everybody who registered with us. We'll also be sharing it on social media. So if you missed some important points, you will be able to go back and listen to this really very fruitful discussion. So hopefully this is a beginning of, you know, a series of town halls that we hope to have. Thank you again for joining us, and stay safe, have a good week, and take care. Bye-bye.